I am very honored to be here this afternoon, start in the morning actually, to be in company of specialized and professional people who tend to our mothers and babies. I greet the chairman of the board, Dr. Romano Vyaruhanga from St. Mary's College, Kisubi. I know if there are any Budonians, they would like to be. The biggest number of doctors in Uganda actually come from St. Mary's College, Kisubi. It's a fact. But we also acknowledge those who went to Budo and Gayaza, and of course Namagunga and Twinte College in Abdiko. I thank Dr. Evelyn Nabunya, the director of the hospital, for inviting me. She invited me so that I make acquaintance with this hospital and the services it extends to the citizens of this country. And I appreciate all of you who have welcomed me, together with my colleague, the minister in charge of health in the Kingdom of Buganda. I'm very impressed by what I saw. I know I told you when we were touring some of the sections of the hospital that my father wanted me to be a doctor. That's what he told me when I was going in S1. But as it turned out, I wasn't very good at chemistry, not even very good at physics either. And I think I was better at the subjects that, brought me to the profession of lawyers. We call ourselves learned, as you know. And that used to rub Dr. Samson Tseka the wrong way. But when you tour this hospital, you realize why Dr. Tseka was asked by lawyers calling themselves learned. The learned people are actually here. In most communities, if not in all communities, the health of women is the health of the nation. Women, mothers, are the primary health care providers in every home. A mother notices a child who is under the weather, who is unwell, whose temperature has risen, whose appetite has fallen. Most mothers, most women will notice that before the men. And women, generally speaking, take charge of the health matters of their children and their husbands as well. Dr. Evelyn Nabunya knows my wife. When I'm slightly under the weather, actually my wife pampers me. It's a fact. But when she's slightly under the weather, I don't even know what to do. I'm not good at encouraging people with low appetite to eat and all these things. I think I'm a little rough there, but I'm a man anyway. So in situations where women's or mother's health is compromised, then the entire homestead will automatically be affected in health terms, but also in economic terms. Because when the homestead is afflicted by whatever illness, hardly any work is going to go on. And in communities where it's the women who work a lot, and as we all know, in many communities, it's the women who grow the food, and the major work of a man is to produce the babies and to collect the money from the woman who has been toiling in the garden and to go and drink. So I'm sure everyone appreciates that when women get specialized attention, especially during pregnancies and after delivery, then the babies are off to a good start, a good and promising start, which is essential for a healthy population. I therefore commend the government for building this specialized women and neonatal hospital. And the government has built a number of impressive health facilities. In Kampala alone, we have Kawempe, we have Chirudu. I think in Naguru, we have a hospital which was built with collaboration of the Chinese government. So the physical infrastructure is important for the extension of reasonable health care. But in my view, the human resources and drugs and equipment are more vital. I therefore urge government to pay special attention to the training of healthcare providers. We should not have situations where healthcare providers go on strike, because that affects the entire population. Government should also pay special attention to the remuneration of healthcare givers or providers. In my opinion, teachers and healthcare providers are the most essential, professionals with regard to the social and economic transformation of Uganda, of any country. And the countries which have appreciated this, like Finland or Germany, you will find the teacher earning far more than a lawyer, both in government employment, and doctors earning far more than soldiers and security personnel. Because even when the security personnel are in need of health care, where do they go? You go to the doctors, you go to the nurses. I think it is basic common sense. I'm aware that government imports plenty of medicines. I visited the National Medical Store in Entebbe and I was surprised at the volumes of medicines that you find in the medical store in Entebbe, and I'm sure in other areas. But a big percentage of these medicines is stolen and sold on the open market. When mothers visit government health facilities, they see the medical personnel, but they don't get the prescribed drugs in those facilities because some public officials have stolen them. That's a vice that the government can fight and stamp out for the good of all of us. But here, in the specialized women and neonate hospital, there is impressive equipment, right from the beds. Some hospitals don't have beds. Some public hospitals don't have beds. But here we have beds, modern beds. The requisite machines, some I've never seen, are all here. So I think this was a good initiative on part of government, and government must be commended. But I again urge government to provide the same. I mean, I think in every region, generally speaking, we have 4 major regions or major provinces in Uganda. The Kingdom of Buganda, Western region, Eastern region, and Northern region. I think there should be a hospital of this standard in each of these provinces of Uganda. It is costly, but losing life is far more costly. And saving life is what is going to make Uganda rich. So it is not rocket science and should not be a political debate. I think this is an area where we all can agree. If we had 5, 6, 10 such hospitals like this one in the country, I think the country would even develop much, much faster. My colleague and I are here to add our little voices to that of Sabasaja Kabaka in the healthcare field. And I had the director talking about the Kabaka and how committed he is to the healthcare of the people of Buganda. And he has been totally committed to the health needs of babies right from the start. with messages urging us to immunize our children, and him participating directly, and to messages that encourage us to give the children a balanced diet. I'm sure you've heard the Kabaka give these messages, or seen him. And the Kabaka has urged expectant mothers to go for antenatal care, to test for HIV/AIDS, because expectant mothers with HIV/AIDS can give birth to healthy babies. If they get the right care, if they could come here, they would give birth to healthy babies, even when the mothers are HIV positive. And generally, the Kabaka has urged us to seek medical services from qualified personnel. There is a danger today, ladies and gentlemen, of many people masquerading as healthcare providers. We hold a number of what do you call them? Exhibitions. What do we call them? Exhibitions for different purposes, and in each of them, a big percentage of people are masquerading as healthcare providers, urging us to eat leaves and herbs and roots and to drink all sorts of concoctions, telling us they cure us from infertility or they make the men sexually active. I don't know where this talk about men being sexually weak came from. I never used to hear this 10 years ago, 20 years ago, but today everywhere you go, they urge you to eat some root so that you become very strong in the bedroom. What is the problem with the bedroom? But I think the moment you mention bedroom matters, it is an incentive for people to buy these medicines, these herbs, these roots. I'm quite skeptical, although I know that there is herbal medicine. It exists, and some people are qualified in administering it. And I think medical science is trying to see how we combine. At least the National Drug Authority has a department that is dealing with this and trying to register the traditional medical, should I say, healthcare providers. But it's important, we've got to go to qualified personnel. That's what I urge people everywhere I am. And to go for checkups even when you're not suffering from anything. It can save you from many problems. So visiting this facility just re-echoes what Sabasajja Kabaka has been doing all along. And also urging fathers to support their wives, the mothers of their children, to get specialized medical care, especially during and after pregnancies. I've met a few fathers here accompanying their wives for immunization, others in the, I think the intensive care unit for babies, NICU, neonatal intensive care unit. I've met a few fathers and I was very impressed. You know, when my wife used to come for labor, fortunately for me, her labor span was very short. I would drop her, and when I returned, she has given birth. To my relief, because I'm a coward. I never wanted to be in the labor ward. Fortunately, every time I would return, the baby is there. And I was like, oh, thank God. There was no one to urge me to go and be in the labor ward as she pushed the babies. But fathers should do that more often, to give support to the mothers. In any case, you are responsible for all these things. The fathers are responsible for these things most of the time. So they should always accompany their wives to the hospital. We understand that fees chargeable here, and Ugandans are used to free medical services from government health facilities. But when you prioritize health of your wife and baby, I'm addressing the men now who are majorly responsible for paying the fees here. When you prioritize health of your wife and baby and receive the kind of specialized care given here, the amount of money expended will be worth it after all. So people should pay something. They tell us that everything free is very expensive. There is an artist called Kazigwe Kapo. I don't know whether these healthcare providers have ever heard of Kazigwe Kapo. He sings good Kadonkam songs. He says, so come and pay some money for the care that your wife needs, or maybe your mother or your sister, and the money you have paid will be worth it all. Kanange njogereyo ku lugato abamu bali byobulamu bamaama be bamanyi omwana nga alwadde era be balabirira ne bataata nga balwadde era buli lwe tubeera mu mbeera ng'obulamu bwa maama bufiiriddwako mu maka wabeerawo obulamu obulungi n'emirimu etambula bulungi ate bannakazadde bwe balabirirwa obulungi nga bali lubuto ne bwe baba baakazaala nga bwe kiri mu ddwaliro lino abaana baba balamu n'emitawaana mu maka giba mitono. N'olwekyo gavumenti njebaza olw'okuzimba eddwaliro lino Specialized Women and Neonate Hospital erifa ku bakyala naddala abali embuto n'abaakazaala ate n'abaana baba baakazaalibwa. Era twebaza gavumenti olw'amalwaliro gonna geezimbye mangi gali wano mu Kampala. Ebizimbe tubyandiza tusanyukira naye tusaba biteekebwemu ebikola ebyuma nga bibiri wano waliwo ebyuma bya mulembe birungi nnyo. Twebaza gavumenti naye malwaliro amalala twagalayo ebyuma n'ebikola nago mu ddwaliro ly'e Kawempe ng'abalwadde bonna bali ku ttaka awo tewali bitanda bijjudde. Tuzaala nnyo bannayuganda tuli obukadde 46. N'olwekyo gavumenti erina okwogera ebyuma n'ebitanda n'ebiki buli mwaka. Gavumenti esaana ekole ekyo nga kye tulabye wano. Ate n'ekirala kirungi gavumenti esasule bulungi abasawo. Embeera y'abasawo okwekalakaasa etuswazanga eggwanga kubanga teri muntu atalwala, buli muntu alwala. Era nze ndoza nti abasawo n'abasomesa, abasomesa si basayansi bokka, n'abasomesa ebyembeera ze tubeeramu bonna bamugaso ekyenkaniddamu. Singa bafiibwako ne basoosowazibwa ojja kulabanga n'abantu abakola emirimu gyonna emirimu bagikola bulungi. Awo nno gavumenti ebafeeko, abasawo batendeke bulungi, ebasasule bulungi, ababba eddagala gavumenti lyegula bakwate babonereze. Sirowooza nti ekyo kizibu nnyo kubanga gavumenti eringiza eddagala lingi nnyo naye lingi balibba. Bakwatibwe babonerezebwe, abalala bayigire ku abo, kijja kutuyamba. Ffe tuzze wano okwongera eddoboozi ku lya Ssaabasajja Kabaka mu kisaawe kino eky'ebyobulamu. Mumuwulidde ebbanga lyonna ng'akubiriza bamaama okugenda mu basawo bwe baba bali embuto, abakubiriza okugema abaana, abakubiriza n'okuwa abaana emmere erimu ekiriisa ekizimba omubiri. Ate era Ssaabasajja akubiriza abasajja bannyini baana bano abazaalibwa okuwerekera bakyala baabwe mu malwaliro. Abasajja mulekerawo obutiitiizi. Abasajja bangi bemmanyi batya nnyo okulaba ku musaayi, batya n'empiso nga nange muntwalidde. Naye mugume mwerekere ku bakyala, kibagumya kibawa essuubi. Wano tusanzeewo abasajja abazze okuwerekera bakyala baabwe okugema abaana, abamu n'abaana abazadde nga tebanneetuuka, ng'abataata bali eyo mu busenge abaana mwe balabirirwa nga bali ku baana baabwe. Ekintu ekyo kinkutteko nnyo era nsanyukidde nnyo bataata abo. Era bamaama tubakubiriza mujje wano, waliwo obukugu bw'amaanyi mu ddwaliro lino. Babakebere nga muli mbuto, bakebere ne siriimu, kubanga osobola okuba olina siriimu naye omwana n'omuzaala nga mulamu olw'obukugu obuli mu ddwaliro lino. N'olwekyo okujja wano kibadde kyakuyiga, era neebaza nnyo abaweereza bonna abali wano olw'okukola n'okwagala. Obusawo kwakuyitibwa bulinga busosodooti. Tobeera awo n'ogamba nti nze ndi musawo, njagala ssente, njagala biki. Nyina mutabani wange musawo, dokita, yajja n'aŋŋamba, mwana wa mwannyina ze n'aŋŋamba nti agenda kusoma, ayagala nnyo okujjanjaba abaana, naye n'aŋŋamba nti njagala kusoma magumba okufuna masters, kubanga abasawo b'amagumba bafuna ssente. Ne mugamba nti sooka okole kiri ky'owulira. Ayagala nnyo abaana, sooka okole ekyo ky'owulira, naye mu baana ssente ojja kuzifuna. N'okola kino eky'amagumba nga weekaka bwekasi si kwe kuyitibwako, n'essente ziyinza okukulema. N'olwekyo kola ekyo ky'owulira, genda osome eby'abaana. Era yampuliriza ekirungi kuba ndi kojjaawe naye nga muli mu kuyitibwa. Kale abasawo nze atabatya gwe ntya. I'm very happy once again to be here, and I thank Dr. Evelyn Nabunya, I think Owengeye, Orugave, for inviting me and my colleague. I'm very impressed by what I've seen here today, and we look forward to a firm collaboration between the Kingdom of Buganda and the Specialized Women and Neonatal Hospital. Jaji? Ah?